Not all fats are the same. This is one of the most important things to understand about cholesterol and diet because the type of fat you eat matters far more than the total amount of fat that you eat. In this video, we're going to explain exactly what the different types of dietary fat do in your body, why red meat specifically raises cholesterol and cardiovascular risk, and what the medical literature says about fiber and plant sterols and additional tools. So first, let's understand saturated fats. Saturated fats are the primary dietary driver of high LDL. These are fats whose carbon chains are fully saturated with hydrogen atoms, making them solid at room temperature. So think of butter sitting on your counter, it holds its shape. That structural rigidity reflects what happens when saturated fat enters your biology. So when you eat saturated fat, it suppresses the activity of LDL receptors on your liver cells, which are the receptors responsible for pulling LDL out of your bloodstream and clearing it. With fewer active receptors, LDL stays in the circulation longer and it accumulates. And this is the primary mechanism by which saturated fat raises LDL cholesterol. So, what are the main sources of saturated fat? Red meat, beef, lamb, pork, especially fatty cuts and processed forms. Full fat dairy like butter, cheese, cream, whole milk, and ice cream. Poultry skin, coconut oil, and palm oil. Processed and packaged foods made with these oils. So, what does the evidence show? Every 1% of calories that you shift from saturated fat to unsaturated fat lowers your LDL by approximately 1.5 to 2 milligrams per deciliter. So across a full dietary change, replacing saturated fat with polyunsaturated fat reduces LDL cholesterol by 10 to 15% and reduces cardiovascular event risk by about 17%, according to meta-analysis in randomized controlled trials. Replacing saturated fat with monounsaturated fat produces a smaller but still meaningful LDL reduction. So the 2026 guidelines recommend keeping saturated fat to less than 6% of your total daily calories. So for somebody eating about 2,000 calories a day, that would equal to about 13 grams of saturated fat, which is roughly the amount in 1 teaspoon of butter plus a small portion of cheese. Now let's take a closer look at red meat. Red meat deserves special attention because the conversation around it is nuanced. It is not just one thing. Why does red meat raise cardiovascular risk? First off, red meat, especially beef, lamb, and pork, is high in saturated fat, especially a saturated fatty acid called palmitic acid, which is one of the most potent suppressors of LDL receptor activity. Second, red meat contains heme iron in a highly bioavailable form. Excess heme iron promotes oxidative stress and inflammation in the arterial wall, which accelerates atherosclerosis or plaque formation independently of cholesterol. And third, processed red meat like bacon, sausage, hot dogs, deli meat, salami, contains added sodium and nitrates. Sodium raises your blood pressure, and nitrate compounds have been associated with additional cardiovascular and metabolic harm. Large epidemiological studies consistently show that processed red meat carries a higher risk than unprocessed red meat, even at the same serving size. Fourth, and this is newer science, when gut bacteria digest a compound called L-carnitine that is abundant in red meat, they produce a metabolite called TMAO, trimethylamine N oxide. So TMAO promotes cholesterol deposition in arterial walls, and it impairs the body's ability to clear cholesterol through the liver. People who eat red meat regularly have higher circulating TMAO levels, and elevated TMAO is independently associated with increased risk of heart attack, stroke, and cardiovascular death. What does the data show? Landmark 2020 meta-analysis that was published in the European Heart Journal, pooling data from about 1.4 million participants, found that each additional 50-gram daily serving of processed red meat was associated with an 18% higher risk of coronary heart disease. Unprocessed red meat showed a more modest 9% increase per 100 grams serving. A study called the PURE study was one of the largest dietary studies ever conducted across 18 countries, found that higher consumption of unprocessed red meat was also associated with a higher risk of major cardiovascular events, though the effect was attenuated in lower income countries where red meat may replace even less healthy staple foods. A 2020 analysis from the ARIC study, ARIC, following over 10,000 Americans found that substituting one serving of red meat a day with plant protein sources like legumes, nuts, or soy was associated with a 14 to 22% lower risk of cardiovascular events. So, what's the practical guidance on red meat? The 2026 guidelines and supporting evidence suggest that you should limit unprocessed red meat to no more than 1 to 2 servings a week. A serving is about 3 to 4 ounces, roughly the size of a deck of cards. Avoid or minimize processed red meat like bacon, sausage, hot dogs, and deli meats. The evidence against processed meat is stronger and more consistent than the evidence against unprocessed meat. When you do eat red meat, choose leaner cuts like sirloin, tenderloin, flank steak, and 90% lean ground beef have significantly less saturated fat than ribeye, short ribs, or 80% ground beef. Cooking method matters. Grilling or broiling or baking is preferable to frying. Cooking red meat at very high temperatures or charring produces compounds called heterocyclic amines and polycyclic aromatic hydrocarbons that are independently carcinogenic and also pro-inflammatory. So the guidelines also say replace red meat with fish, poultry without skin, legumes, tofu, nuts, and seeds. These substitutions have consistent evidence of cardiovascular benefit. Now let's talk about trans fats, the ones to completely avoid. Artificial trans fats created by partially hydrogenating vegetable oils are the most harmful dietary fat known. They simultaneously raise your LDL and lower your HDL, which is a double hit on your lipid profile. They also promote inflammation and insulin resistance. The good news is that the FDA banned artificial trans fats from the United States food supply in 2018. However, small amounts can still be found in packaged foods. And labels are allowed to say 0 grams of trans fat if the serving contains less than 0.5 grams. Look for the words partially hydrogenated oil in the ingredient list and avoid any product that contains it. Natural trans fats exist in small amounts in dairy and meat from ruminant animals like beef or lamb. These appear to have neutral or slightly positive cardiovascular effects and are not a concern. What about PUFAs, polyunsaturated fats? Let's talk about the beneficial replacement. So, polyunsaturated fats have multiple double bonds in their carbon chains, making them liquid at room temperature and biologically active in important ways. They are divided into 2 families based on where the first double bond occurs. Let's start with omega-6 polyunsaturated fats. So, the primary omega-6 fatty acid in the diet is linoleic acid. It is found in vegetable oils like corn oil, sunflower oil, safflower or soybean oil, and also in nuts and seeds. So when you replace saturated fat with an omega-6 PUFA, LDL falls about 10 to 15%. The landmark 7-country study and the subsequent Minnesota coronary experiment, as well as more recent meta analysis, confirm that this substitution reduces cardiovascular events. A 2009 meta analysis in the American Journal of Clinical Nutrition found that replacing 5% of energy from saturated fats with linoleic acid was associated with a 10% lower risk of coronary heart disease events and a 13% lower risk of coronary death. What about omega-3 polyunsaturated fats? Well, omega-3 fatty acids are the most studied beneficial dietary fat in cardiovascular medicine. There are two main types: the plant-based omega-3, alpha-linolenic acid, ALA. It's found in flaxseed, chia seeds, walnuts, and canola oil. The body converts ALA to more active forms, EPA and DHA, but the conversion is not efficient. Only about 5 to 15% gets converted. Still, a higher ALA intake is associated with modestly lower cardiovascular risk. And there's the marine omega-3. So EPA and DHA are found in fatty fish like salmon, sardines, mackerel, herring, anchovies, and trout. These are the most biologically active forms. They lower triglycerides by 20 to 30% at dietary intake levels and by 30 to 50% at prescription doses. They modestly raise HDL. They also reduce inflammation, they lower your blood pressure a little bit, and they reduce platelet aggregation, which makes the blood less sticky, and they stabilize heart rhythm. The Gissi Prevenzione trial, conducted in Italy with over 11,000 heart attack survivors, found that omega-3 supplementation reduced cardiovascular death by 30%, reduced sudden cardiac death by 45%, and total mortality by 20%. A more recent trial called Reduce It trial, using prescription doses of EPA, which was 4 grams a day, in patients with elevated triglycerides on statins, found a 25% relative reduction in major cardiovascular events, including heart attack, stroke, and cardiovascular death. The recommendation then from the 2026 guidelines is to eat fatty fish at least twice a week. Each serving of fatty fish provides about 1 to 2 grams of EPA plus DHA combined. Now let's talk about the monounsaturated fats, the Mediterranean fat. So monounsaturated fats have a single double bond and are liquid at room temperature, but they can solidify in the fridge. Olive oil is the quintessential example. Other sources include avocado oil, almonds, cashews, hazelnuts, and canola oil. When monounsaturated fats replace saturated fats in the diet, LDL falls by about 5 to 10%. Fatty acids also tend to maintain or slightly raise your HDL, unlike carbohydrate substitution, which raises LDL particle number and lowers HDL. Extra virgin olive oil contains additional bioactive compounds beyond its fat contents, like polyphenols, oleocanthal, and oleic acid, and these have anti-inflammatory, antioxidant, and antiplatelet effects on arterial health. That is why olive oil appeals to confer benefits beyond what its fatty acid profile alone would predict. We'll cover the major clinical trials supporting this, the PREDI-MED, in our next video about the Mediterranean diet. What about dietary cholesterol? Now that is a nuanced topic. So for decades, dietary cholesterol, which is found in eggs, shellfish, and organ meats, was considered a major culprit. The science has become more nuanced, though. For most people, the liver compensates for dietary cholesterol by producing less cholesterol of its own. However, about 25% of people are hyper-responders whose LDL rises meaningfully when they eat more dietary cholesterol. People with diabetes or FH, familial hypercholesterolemia, also tend to be more sensitive. The current guidance is not to obsess over dietary cholesterol, but to focus primarily on saturated and trans fat. An egg or two a day appears safe for most people. Shellfish, despite having cholesterol, are low in saturated fat and generally fine in moderation. Organ meats like liver are high in both cholesterol and saturated fat and should be limited. Now, soluble fiber and plant sterols. Soluble fiber dissolves in water to form a gel in the intestine, and this gel binds bile acids, which are made from cholesterol, and carries them out of the body in the stool. The liver then has to make new bile acids, drawing on cholesterol to do so. This lowers your LDL by 5 to 10% with consistent intake of 5 to 10 grams of soluble fiber a day. Best sources of soluble fiber include oats and oat bran, beta-glucan, barley, psyllium husk, beans and lentils, apples, oranges, pears, and flaxseed. A bowl of oatmeal provides about 2 grams of soluble fiber. 3 servings of oats a day, as studied in clinical trials, lowers LDL by about 5 to 7%. Plant sterols and stanols are naturally occurring compounds in plant cell walls that are structurally similar to cholesterol. They compete with cholesterol for absorption in the small intestine, so they block the uptake of cholesterol. At 2 grams a day, that's the amount in about 2 to 3 tablespoons of sterol enriched margarine or a sterol fortified juice, they lower LDL by 8 to 10% without affecting HDL or triglycerides. They are safe for long-term use. They are less effective in people already taking statins with very low LDL levels, but they do add meaningful benefit in statin-naive patients or those on lower intensity therapy. Okay, so summarizing, the type of fat on your plate matters as much as the amount. Saturated fat concentrated in red meat and full-fat dairy suppresses your liver's ability to clear LDL. Red meat carries additional risk through heme iron and TMAO, with processed forms carrying the strongest evidence of harm. Replacing these with polyunsaturated and monounsaturated fats, which are found in fish, nuts, seeds, and olive oil, consistently lowers LDL and reduces cardiovascular events across decades of trial data. Add soluble fiber and plant sterols, and you have a powerful evidence-based toolkit before a single medication is ever needed. In our next video, we'll put these fats together into 2 complete clinically proven dietary patterns, the Mediterranean diet and the DASH diet, and we'll walk through exactly what the major trials have found.